Alright guys, so for this lecture, for chapter 14.2, we're going to be talking about the diagnostic coding and encoder software. So we're really going to break up how to do diagnostic coding, and we're going to talk a little bit about the softwares that will assist you. So basically we're going to explain how to abstract the diagnostic statement from the patient's health record. We'll talk about describing how to use the most current diagnostic codes and perform diagnostic coding, and then identify how encoder software can help the coder assign the most accurate diagnostic code. It's going to be a short presentation today, guys, short lecture. There's only a couple slides that we really need to cover, but it's extremely important to understand these concepts so that we can be the best coders possible. In order to code, you have to prepare for medical coding, and there's many different things that we have to do. But the first thing you have to do is to extract the diagnostic statement. So, as medical assistants, we have to analyze the patient's health record and abstract the diagnostic statement documented in various reports. All right. So there's different sources of diagnostic statements that could include the encounter form. Another name for the encounter form is also known as a super bill. So it's important to know that as well. That will be a question on your CMAA exam. You can find diagnostic statements in treatment notes, in their discharge summary, and their operative reports, and as well as the radiology, pathology, and lab reports as well. So those are all different ways and places to find their diagnosis. So the encounter form. The encounter form can be viewed in their electronic health record, and it is most commonly used to obtain the list of medical services rendered and the treating diagnosis when the total charges are trying to be calculated. So this is vital information. It is vital that the form used by the medical practice is reviewed annually, it is up to date, and is the most current that is accepted. So medical practices should ensure that the current encounter form uses ICD-10 codes, not ICD-9 codes, because ICD-9 codes are no longer being used. Then you have the history and physical examination, or your H&P. So H&P are the start. So after recording the patient's history, the provider performs a physical examination. Okay, so you go into the physician's office or the doctor's office. They're going to ask you a bunch of questions regarding your medical history, your social history, different things like your past medical or your family medical history, as well as the history of your current illness. So after they do that, then they start their physical examination. They start to take temperatures and do different things like that. So this includes both objective information and subjective assessments of the patient's physical status. Now the physical objective and subjective information, there's two different things here. Objective information are things that you can see and measure, okay, while subjective things are what the patient tells you. So it's important to note those things. So the history and physical examinations are the starting point for the patient's narrative medical evaluation. H&P begins with a statement of the patient's own words that describes the reason for seeking medical attention. I've been sick for the past 2 weeks, my throat's really sore, I've been vomiting, I get dizzy when I stand up. Those are the types of statements that they're looking for. And those are primarily known as the chief complaint, which the abbreviation is CC for that. It's important to know that as well, guys. Then you can get it in your treatment and progress notes. All right? So the treatment notes are the second most common medical document from which diagnostic statements can be extracted from. The most commonly used format is the SOAP format. SOAP represents, it's a way to organize their medical office visit and to take the most accurate medical notes as well. So the SOAP stands for subjective, objective, assessment, and plan for treatment. All right, and we'll talk about SOAP notes further on in the future here. So diagnostic statements can most often be found in the assessment portion of the SOAP note. So subjective information is what the patient tells you. Okay, objective information is what you can see, measure, or examine during your physical examination. Assessment is basically their diagnostic statement. So what's going on with them? And then your plan for treatment is going to be steps for future use. Okay. The discharge summary. So the medical office can use a discharge summary as an overview of the patient's condition, especially if the discharge was recent. So it's used primarily for extracting diagnostic information for patients who are hospitalized rather than those who were seen in a provider's office. So it's important to know the difference there. So some of the main elements of a discharge summary would include the patient's admission date, the date of the discharge or when they were released from the hospital, their H&P findings, the clinical course during hospitalization, so what clinical aspects were performed on this patient while they were staying in the hospital, the health condition upon discharge, so how were they when you discharged them from the hospital, discharge diagnosis. So after they've been discharged, what was the diagnosis that they gave you? And then the aftercare plan is after the patient leaves the hospital, what are the steps for care for them? That can be found in the operative report. Okay, so the operative report is used for patients who underwent surgery as either an outpatient or an inpatient. Okay, now an inpatient may require a hospital stay. Outpatient is like a surgery center where you go in and leave. These could include preliminary diagnoses and procedures, the final diagnosis and procedures, and detailed description of the operative procedure from the start to finish. So the medical assistant uses the final diagnosis for searching for and selecting a diagnostic code. So it's important to know which reports you're most generally going to be looking at in your line of work. And then, of course, the radiology, laboratory, and pathology reports. So these are used to establish diagnostic statements. So any findings from these reports must be documented in treatment notes so that they can be used for diagnostic coding, the charge entry, or insurance billing purposes as well. So now we're going to talk about the steps needed in order to code with the ICD coding manual, okay? So accurate ICD-10-CM coding requires 8 basic steps, and if you look on page 264 in your textbook, it gives you table 14.3, which is titled Diagnostic Coding Step by Step, and they give you the example of Parkinson's disease. And I want you to follow along with that as we go through this presentation, so you can kind of see the steps in order to do your assignment for this chapter later on. So the first step you need to do is to determine the correct diagnosis from the diagnostic statement. So you read through their health history or HMPs or their discharge summaries, anything where it depends on your facility and what you do there. Once you figure out their diagnostic statement, so for this example, we're going to use Parkinson's disease. Now you know what to look up. Now you know what you need to have to code. You need to have to code Parkinson's disease. So that was the diagnosis that the doctor told that patient. So step 2 is to use that main term and look up the diagnosis in the alphabetical index. So if you look in an ICD manual, there will be an alphabetical index in the front, okay? And ours here in the classroom are all the front gray section. Okay, so you need to use the main term, like I said, Parkinson's disease, and look that up in the alphabetical index. And in your ICD-10 book, it'll come up as Parkinson's disease syndrome or tremor, and it'll also tell you to see Parkinsonism. Okay, so if it tells you to see another term, such as Parkinsonism, look up that C term in the alphabetical index, and then you're going to give you Parkinsonism, and then give you a code G20. So after that, review the essential modifiers under that main term. So that main term of Parkinsonism, okay, we'll have a bunch of different terms underneath of them, and there's probably 15 or 20 of them listed here underneath Parkinsonism, and you would have to select and review the essential modifiers under that main term, and then be able to choose the correct essential modifier based upon the diagnostic statement and what was written in there. So if it was just, if Parkinsonism was due to drugs, there's a code for that. If Parkinsonism was secondary due to external agents, something along those lines, it can be coded a different code as well. So it's really important to know the specifics about that diagnosis. The next step would be to look up the code in the tabular index. So once you have a pointed code, so for this one, we're just going to look up G20, which is the Parkinson's disease code. So you would need to look it up in the tabular index in the G chapter, okay? And then you need to check for any coding guidelines, conventions, inclusions, or exclusions notes, or any additional characters. And then you need to, after you figure out which code you need specifically, then you would assign the final ICD-10 code and bill accordingly, okay? So that alphabetical index that we talked about. So those were the 8 steps, okay? You follow those 8 steps every time, you will be a good, proficient, and efficient coder, all right? So using that alphabetical index. So after you have abstracted that diagnostic statement and identified the main term that you need to look up, you need to start by searching for the best code or code range in that alphabetical index. So it is important to note that the alphabetical index should only be used as a tool to locate the appropriate code. The tabular list, however, must always be used to confirm that the code or codes selected are accurate and specific. So if you look here, and this is also figure 14.8 in your book, this will present an excerpt from the alphabetical index for the main term cyst. And it's important that you note the essential and non-essential modifiers that are listed below them, and that there are separate terms for your left and right eye. So it is essential that you really pull out all the particulars to each diagnosis and code it accordingly, because each one will have a different code. Even your right and left eyelid might have, you have an upper and lower one. So it might be the left lower, the left upper, the right lower, the right upper. So it's really important to know which code you need to use. So once you have that code or your range of code that you're looking up, then you go on to your tabular list, which would be in the back. So once you've identified at least the first three characters of the code in the alphabetical index, then you turn to your tabular list in the back. And basically the chapters in the tabular list are arranged alphabetically according to the initial letter of the 3-character code. So for the cyst of the eyelid, we're looking at H. So you would flip into the chapter that pertains to the letter H. And if you look on this is also figure 14.9 in this book, and it shows you an excerpt from the tabular list showing cyst as the main term, cyst of the eyelid, and then they get down and break it up into more in-depth definitions there. And this is the last slide for this presentation, guys, and it's just a brief one about Encoder Software. So Encoder Software is a tool that is commonly used by coders to assist in medical coding. It helps you pick the correct code, it makes it more accurate, and makes it faster and efficient. Okay, an example of this would be like a true code is an example of it in Encoder Software. And basically it performs computer-aided coding to assign the most accurate code as possible. Coders type a few words into the search box, and the software finds the most likely matches in the alphabetical index. And this can help by increasing the speed and efficiency of coding for a wide variety of medical causes. All right, and that is the presentation for today, guys. Really short, really easy, but medical coding and diagnostic coding in particular are extremely important in the medical office. So being proficient and efficient with these as a medical administrative assistant will only set you up for success in your future. Good luck and have fun, guys.